Thank you, everybody. Welcome to this session. It is a really special session. Um, so far in the course of this foundation program, we've talked about a lot of important things pertaining to palliative care. And we've talked about total pain and how it affects people, how pain affects people depending on their life circumstances. We've talked about invisible patients within families. Today's session highlights not just invisible patients, but invisible communities, a community that very often gets left out of not just decision making, but also of access to healthcare. We've had a session on equity, which I think sheds a light on how something that is equal is not necessarily equitable. And that is also a very important part of today's session. And finally, we've also talked about social determinants, what determines a person's ability to access healthcare that is appropriate and affordable to them. And the reason we invited Sameera to talk to us today is because here is a community, LGBTQIA+. I wonder how many of us knew all the different alphabets that make up that community. So today's session is to give us an overview of what exactly the definition is. Who do we talk about when we speak of the LGBTQIA+ community? Because till Sameera's first session with us a couple of years ago, I have to say that I didn't know very much. And I was a supporter of the movement, but I certainly did not know even 10% of what was taught to us that day. And it was such an eye-opening and heart-expanding experience for me, because we talk about compassion in palliative care. It's the cornerstone of palliative care service delivery. And we can't truly be compassionate if we're not inclusive of everyone. So Sameera, just to give you a background on Sameera, Sameera was earlier at the Mahatma Gandhi Medical College and Research Institute in Pondicherry, where she was an assistant professor of critical care medicine. And today, Newham University Hospital, Barts Health with the NHS in the UK. So she's joining us from the UK. We've blocked her time some time back, and she has a very busy schedule, but thank you, Sameera, for being here. And you're a very dear friend of PALLIUM India's. You're always welcome, and we're really happy to see you. So over to you, and I will be here to co-facilitate. I will be monitoring the chat box, feeding questions back to you, and also just moderating the discussion as we go along. Thank you, Sameera.
Thank you. So today's session, we are going to divide into two, with a cut in between. I already shared one video of Noori. I hope it has gone on the WhatsApp group and people have seen that video earlier. So first session, as Smriti had talked about it, learning the very basics of terminology or knowing the very basics of terminologies, and a little bit touch on it's always a personal reflective journey, being a part and parcel of the community that I'll be covering up, so that you all will get basic crux of what LGBTIQ community is. And then after that, we will take Noori's life as a prototype, where we I'm trying to fit into the bracket of palliative care principles, where it's an exercise for you all guys, where you can interact on this forum, and let me know about it. What is your understanding? And that's understanding for me, and the star rating for me, that okay, I have done my job well. Okay, so let us start now. Let me share my screen. Hello, am I audible as well?
You're audible, but we're seeing your overall screen. We had your presentation on earlier, Sameera.
Yeah, I'll go ahead now. I guess I may not be able to hear you all when I'm doing presentation. So once the presentation go as such full, then I'll stop it off, exit the share screen, and then take a break of maybe some 10-15 seconds, and then we'll go ahead with video discussions and the part 2 of it. Okay, I'm all.
Sameera, you're on mute. You'll have to unmute yourself.
All right, sorry. Thank you very much for inviting me. It's always a pleasure to be part and parcel of activities done by Pallium India. And for this project on, the fellowship program, and including even and considering the importance of including LGBTIQ community also part and parcel of palliative care. So when we talk about palliative care, we always talk about fit into the physical, psycho, emotional, social, and spiritual aspects of palliative care. And I'm sure you guys all have been reading about it, looking about it. And over the next 15 to 20 minutes, the objectives of this session is for me to convey to what are those basic terminologies related to the LGBTIQ community. So what is basically LGBTI stands for? Going to the core concept of sexual orientation or sexuality and gender identity. What is the structure and how like an umbrella spread out the transgender community is how colorful, diverse community the transgender community is in India. uh, what are the core related issues when the trans people come in contact with the healthcare system currently? And the most dreadful thing is they get discriminated. So what is that healthcare discrimination is all about? Touching, when we say that we are going to talk about health care, palliative care is part and parcel of a domain of health care. So what are their needs and how the palliative care can be taken for or bought for this community? So so going back to the very basic, what is sex and what is gender? uh, what is sex is what you see when a child is born, and you see and define the anatomy, seeing the anatomy of that human being. You say that, okay, this anatomy looks like a male anatomy, this looks like a female anatomy, or this doesn't fit into male and female anatomy, so it could be an intersex. Mind you, the sex is absolutely an anatomical definition, or what you see, the genitals, based on that you define the sex of the individual. So sex could be male, female, and intersex. On the other hand, what is gender is, it's not at all related to what you have it on your body, not at all related to your genitals. It is something what that person perceives, feels, attribute, have that attitude, and all behaviors which are many of the times culturally associated. Like for example, to say a simple example, that many women in today's generation, they express their gender not in a traditional feminine way, in the sense that yes, many of the 90-80% of women might be wearing saris, but a few of them may not be wearing saris, but they would like to use jeans and t-shirts, which is like somewhere like worn by both male and female. So this is like the expression and going beyond your cultural association. So that is one aspect of expressing your gender. But what you feel, what you are inside, what is your innate sense is of belonging to either man, woman, both, or none, is what gender is all about. So what is this LGBTQI stands for? It's a rainbow. Okay, it's such a diverse community, and this cartoon itself is self-explanatory for that. As I said it up, the sex is where it is defined by your anatomy, male female anatomy. What you think is not relating with your genital anatomy. So your gender is perceived somewhere what you think, okay, what you would like to affiliate, associate, or identify as being a masculine, feminine, or male, female, or both or none. You could be a gender, you could be both the genders, you could be a man, you could be a woman as your gender identity. So this is about sex and gender identity. What is mean by what is mean by sexual orientation is somewhere you have got an attraction, you express your sexuality or sexual attraction, and based on that you have a spectrum of LGB. So a person you say is a lesbian where she identifies herself as a woman and is attracted physically, emotionally to a woman, is a lesbian person. A gay man identifies as a man and is emotionally and sexually attracted to a man, is gay man. Bisexual, individual who is attracted physically and mentally or emotionally to both a man, woman. Okay, it could be at one part of their life, it could be together. It is nowhere related to monogamy, polygamy. Okay, that is something absolutely a different concept. And such person is bisexual individual. And as I said it up, transgender is gender, that is gender identity. Many of the time there are people who do not have any understanding or do not want to affiliate to any of the sexuality or sexual expressions, and they are still questioning and not able to fit themselves into any of this bracket, could be labeled as queer. And as I said it, that intersex is one of the six category apart from male and female, where the anatomy does not typically fits medically or scientifically into a male and female anatomy, is categorized as or is known as intersex people. So this is absolute diversity, and that's why the symbol of rainbow, the community, the rainbow, a absolute diverse community where you have got your uh, various sexual identities, gender identities, and sexualities. Now, what I said it about as an example, that what is your expression, the gender expression about it, is how you can be anything. You can be a man, woman, or a transgender person, or a non-binary person, meaning not a man, not a woman, and you would like to way that you want to express yourself. As I said it up, a woman does not always would like to wear saris and churidars, but always would like to express herself as in jeans and tops. This is more of a masculine probably expression. A man who may not would like to, in a typical sense, that what you say, would not like to express himself like in a masculine way, but in a feminine way. That is his or their gender expression. So expression can vary. So this is all permutation and combination, and that's why the community is considered absolutely diverse community. So coming back to the demography and very core, talk on or about in what is happening about transgender people in India. Unfortunately, the demography the Bharat Ki Janaganana, which happened in the census happened in 2011, we exactly still do not know how many transgender people are there in India. The reason behind is it's quite a gross underestimate. The reason behind is that when this census happened, it was categorized as third gender. And as I said it, that many people, the community is quite diverse. Many people just do not identify themselves or fit into third gender. And a very classical third gender community currently in India is Hijra community, where those got counted. But transgender people could be trans men, those who have transitioned from a female anatomy or to male anatomy, or those could be non-binary trans people or binary trans people. Binary trans people meaning those who do not want to identify or related to Hijra cult, or would like to say that they have transitioned from man to a woman and woman to a man, um, by medically, those who would not like to get included into the categorization of third gender. So it's definitely a gross underestimate, and currently we do not know how many transgender people are there. When you see the the distribution, where they are typically populated, and that's something which is a surprising thing, where this graph is typically relating to one third gender, I mean a sect of third gender population, and you'll see that uh, the progressive states in India, Kerala and Gujarat, if you consider, they are very low or less populated. So that's something which is a paradox. When we say that we have got a progressive society, probably it is not progressive enough to include trans people in their culture and in their care. So how diverse is this traditional Hijra community? The structure is like quite dynamic. You have got Guru and Chela system, where you have got uh, you know they have got their own culture and the family structures and hierarchy with which they are living. And apart from that, you have few other people who are associated with transgender community, and who are financially dependent, educated, and accomplished people. Like, for example, Nartiki Natarajan, who is a Padma Shri awardee from 2019, my friend Viham Pitambar from Kerala, Anjali Amir from Kerala, and Aryan Pasha, who is working as a lawyer in Delhi. So there are people who are or who do not want to typically associate with the Hijra culture. So it's absolutely a diverse community. Now, coming back to the healthcare and what way we baffle as a transgender people, to say to my personal journey, when I started my transition 10 years ago, and I had to go for my laser procedures. So this was one of the institution in the city back home in India where I worked, and 15 years ago, I worked and ran on these corridors as a junior resident, taking care of the patients and doing resuscitations and running back and forth from ICUs and OTs to ward. And I was sitting and waiting for my turn to happen up there. And the junior resident came and said it to me that we can't take care of you because we are going to charge you because if we continue to take care of you here, we do not want other people like you to come here. Okay, so this is something what really made me shock. I i was so scared. I was not understanding what to do at that moment. I just ran away from from that. So this time I ran away on the corridor, leaving the corridor rather than taking care of my patients there. So why this happens? Okay, leave about the client related discriminations. We can talk about it, a hell lot of things about it. But when we are healthcare providers or associated healthcare professionals, how and what way are the reasons. So the core reasons is your knowledge is not there about it, and the solution is getting uh, inclusive curriculums included while teaching. And that's why this program is, where we are going to learn about the needs of the community, having a right attitude. It's like something which is going to happen up over the period of years and years. It's where you need to retrospect yourself, what are your beliefs are, and how you can shackle your beliefs, challenge your beliefs, and come out of it and be open-minded about it, and practicing it, understanding the law of the land, where you are and what are the legalities involved into while you are taking care of it. Because now there are quite a lot of things that are happening past 5 years, specifically this last decade, where the community could establish their human rights, though they are on the papers. Yes, every time we have to go back to the courts and try to make saying heard through court. So we need to have those clarity of medical legal aspects, also legal aspects related to that. So when we go back with our classical teachings, we understood that this study was done in Ahmedabad. We understood that where there was, it was done in the medical students, where the questionnaire was shared with them. And the outcome out of it was realized that the basic, understanding itself about homosexuality is very poor about it. And what you need it is, yes, people are interested. What you need to have an empathy in association with approach and attitude that, okay, you are ready to learn about it. And definitely there will be more and more inclusive medical society also out of it being generated. There are very specific stresses in the lives of LGBTIQ community. The most important being trying to fit people belonging to this community, specifically trans community, into set gender norms. As I said it up, that male and female gender norms. I'll tell you a simple example that when I was making my journey from India to UK still have male and female gender binary categories everywhere. So even if you are a transgender person, I do not have any means of establishing myself as my gender identity as transgender anywhere on papers here in UK. But back home in India, I still have my rights to get myself included as other or gender identified as transgender separately in few of the forms and few of the documents which are being established in India. Heterosexism meaning fitting everything into heterosexual ideas and set norms about it, that you need to have a family, a marriage between man and a woman. A man cannot marry a man, a woman cannot marry a woman, a transgender person cannot marry a woman, or transgender person cannot marry a man. So having that very fixed ideas about heterosexism. The families, uh, uh, for transgender people, as I said it up, while going back to the Hijra cult and culture, they have their own set of family norms where biological families are being disregarded and thrown away, and they develop their own family and family structures. And setting and putting those boundaries on the community is something which is a big stressor. Bullying, abuse, uh, very specifically been faced by children who are non-conforming and getting into the heck of what is their gender is, or do not want to get into the heck of what my gender or fixing my gender is. That is something which is a very crucial and stressful period for non-conforming children, and that's what where bullying and abuse happen. The community faces a huge problem with suicidal tendency because of all these issues, and we call it as minority. The word is minority stress model. If you just Google and find it out what is minority stress, and you will relate it and understand how the community gets exposed to the high suicidal rates. And on top of it, you have got something called as conversion therapy, where people are all set that no, you can convert yourself and to fit into something called as a heterosexual bracket. So why do we die? This is what is about LGB community, and this is what is about a snapshot of a transgender people life. We die most of the time because of families, what you call as biological families, they do not accept, and that is the biggest stress. Have suicidal attempts. We do not have the legal identity. Fortunately, now India is changing, but UK is still behind, and I'm here in the UK, and let us start something for that here. We are refused medical care, have experienced homelessness. All these are clubbed together to kill us. And these are the beautiful few examples which gives you an idea. One of my friend from Vinay Chandran from Savava Trust, Bangalore, this is an unpublished data which we presented in one of the conference in Nimhans, where these are the few examples just to read it out quickly. Where the people from community get in contacted with healthcare system, and you will realize that how violent the system is. The nurse rubbed my forehead with cotton very quickly without taking the glass pieces out. I told her to stop, but she just kept at it and muttered, "You people deserve this." Because of her, I have scars now. Doctors, the doctor there wouldn't even touch me by hand. He would only touch me with the syringe. This is what a person who went to the clinic, a trans person, doctor do not want to touch or examine, and this is what he or that doctor had done to that transgender person. Everyone in the hospital looks at me, looks at us weirdly. The doctor makes us wait and will see us after everybody else is gone, even if other patients have come after us. So you are the somewhere which is need to be sitting in one corner and not to be disturbed with his doctor's clients, and to be taken care of. I have given my example already to you guys. The nurses at the hospital are very rude to us, community, and ye to HIV wale log aa gaye. Yes. And as I said it up, conversion therapy, where to say it up as a reflective learning for you guys, one doctor said to me, this wanting to be a woman is nothing big. It's just like cigarette and boozing. If you want it, you can let it go. So choose between cigarette, booze, and what you want to be as a man or a woman. Doctor told me you are living with dissociative identity, so making all of us as a mental illness phenomenon. There are prejudices, like for example, very shackling, very important prejudices, prejudice, very specifically related to trans men, where the uterus is being having considered only for an organ to give birth to children. So what you need to learn out of being a healthcare professional, please remember that do not make assumptions. There are increasing recognitions about sexual orientation and gender identity, and slowly depathologization has already been started. 2014, the Nalsa judgment, if you Google it, you will definitely know about it. What is Nalsa judgment? This is what was the first legal judgment which came in, given by Supreme Court, which is a landmark judgment. And this is the base judgment considered for all the advocacies and legal fights which are coming up now, which the community is taking help of, getting established with their right. And another one where some of the parts of Section 377 got nullified, where homosexuality is now no longer considered as crime. A consensual relationship of adult LGBT person is no longer a crime in our country, in India. And very recently, April 2019, unfortunately, I have not included transgender persons' rights of protection, though it is lingering and though it is not complete as such, definitely some amount of amendments will happen about it. So coming back to where the palliative care, as I said it up, is one of the associate, one of the gamut, one of the part of giving care to transgender people. When we all are going to grow old, when we are all old, and very recently it happened one incident in my ICU where one of the gay couple got admitted in the ICU, and what are their beliefs needs to be shackled, where are you clear with the non-discrimination based on their sexuality and gender identity, how well you are going to support the grief of this community, what assumptions you are going to make out of it. Like for example, the nurse said the first next of kin is a man. To this man, oh, it could be a brother of him. But then the consultant intervened and very quickly told that no, please do not have the assumption, and the person who is written as a next of kin is not brother but his partner, his husband. Okay, so religion, and we know about it that there are different sects, religion do affect, the religious beliefs do affect, and the last rights of community, people who belonging to LGBTI community and believing certain sects of religion may not get their last rights fulfilled. So who can give the care for palliative care? You all dynamic people, because palliative care is all about not just related to the doctors and nurses. It's a huge community. You all are the participants uh, in delivering the palliative care to the trans community. We will be practicing after this break. This is my last or second last slide before the Nouri's video we are going to discuss, and then start up our reflective learning, where we will look into sorry, we will look into very basic principles which need to be included and which are included into palliative care. Most important thing in palliative care is communication, and what community needs is their gender needs to be addressed very well, and gender is self-determined. If somebody is coming and saying that I'm a man or a woman or a transgender, that needs to be reflected, and that need not be explored just based on how externally that person looks. A person can come and sit in front of you in trousers and t-shirt with beard, and the person can say that I am a trans woman. Accept that, because that is that person's, his or her, or their right to determine their own gender. A confidentiality also needs to be maintained, and that is to be the most dignified way a healthcare professional can do it off. So what needs to be done is ask them in a very simple way, rather than defining and bordering and putting them into a bracket of sir or ma'am. Very clearly ask them what way you would like to address yourself. Understand that families are different for different people. They have their own family structures, and not the biological family, the idea of biological family. What way the shared decision making will happen? Understand what is going on into their lives and what their needs are, and accordingly cater their needs, rather than just having a paternalistic attitude, and which we see very commonly. Mental health is the biggest need for this community, and the lacuna needs to be filled. Unfortunately, palliative care is blessed with many mental health professionals, and this is the area where the community will benefit more and more. Pain and palliative care, pain and symptom management, cancer, there is more and more research is going on. Just imagine a person, a trans woman who externally looks and expresses herself or their self as a woman, uh, still have her prostate inside, because the genital anatomy is externally changed, not internally changed, and she will be having a prostate inside. So they are prone for malignancies if they are genetically or external, or the hormone which are consumed by them can make them vulnerable. and that's how they might become susceptible to see a prostate. So don't you think that this is something which is very complex, and how and what way you are going to handle of this? So definitely this intricacies need to be understood so that we can have a best palliative care being given to these clients. And as I said it up, that what are the legal issues? Mind you, the legal issues are brightening up in our country, where health rights are also being on the way to be established for them. Do not land up into a tricky situation that somebody comes and you baffle up with the legal situations related to that. So to say it up, that when I thought about it, if people from this community, they are not going to live well, are they going to die well as well? So when you are not going to, somewhere the community or the society is not giving them a life to live, but at least can we think about, with all the dimensions, how well we can give them at least a proper end of life care. Thank you.
Thank you, Sameera. You were going to say something, sorry.
Yeah, so this was our first session, and now I hope everybody has seen the video which was shared in the group, Nouri's group. So let us give a 15 seconds or 30 seconds wait. How much time do we have it now left?
We have time. We have about, Manisha, about 40 minutes. We can't hear you. Sorry, you're on mute.
Sorry about that. We have about 45 minutes left.
All right, so good amount of time to discuss then and people to interact here. So the major interaction is going to happen by putting messages on the chat. So I hope, yeah, I can see
Parul has
Parul
said that, yeah.
has mentioned about it. Okay, so let's give another 15 seconds. I hope everybody has seen it. If not, it's just a 3 minutes video and we have 45 minutes time, but I want more and more discussion. Just run it on your mobile phone and read the subtitles while we are running through my PowerPoint slides, where we are going to put all those what Nouri has gone into it and understand what way the palliative care is, where we are going to fit her principles into it. So shall I start sharing my slides now? Shall we go ahead, Smriti?
Sure, Sameera.
Okay. I'm not sure whether I'll be able to see the people's reaction.
So you just let me know and I'll feed them back to you.
Yeah. Or shall we do it if like this, if Manisha shares the screen, my presentation, the second one, so that I'll be able to see the comments also and we can interact it in a better way. That will be
I think
better.
that's a good idea. Very good idea. There's some comments coming into the chat box now, Sameera.
Yeah. It's really sorry to see that she is struggling to establish a house and up to child kids. Yes. So she has her family now, Avatar, and she has her kids now. So big family for Nouri to take care of.
While we wait for Manisha to pull up the video, also, I just want to, maybe we'll take a minute to invite some comments or reactions, responses to the first part of your presentation, Sameera, because I suspect that a lot of what you shared today is new information.
Yeah, sure.
Yes, Alpa, we'll take a few minutes for open interaction at the end.
Alpa wants to share experience. Okay. What are the difficulties you underwent during this lockdown in UK specific to social and medical? Okay, John, my thing is that for first, whatever hormones, one most important thing is the transition from UK, from India to UK is I could take only 3 months of hormone. So I took 2 months of hormones instead of 3 months of hormones with me. And I did not get my hormones on time. So it's like almost like 1.5 month gap. And the system is where here is quite rigid. I'm sorry to say that, like, you have to go through GP to the specialist. I still have not got my specialist appointment. Fortunately, I could swarm through and get my hormones from GP's help, probably just because I'm a doctor and I have colleagues here. But just imagine a person coming from other countries and coming here to in the developed country, in the nation, still you have got a very rigid norms where you will face these troubles. That is one. Second thing is, starting from when I was filling forms for my GMC registration in UK, it's all like male and female, male and female. And I really wonder that why people here are so rigid about it, that where there's something called as DBS check, where they check the criminal background, the UKVI check the criminal background here, and they would like to keep this information that about your gender identity as something personal and anonymous. Now I express myself as like I am a transgender person. I'm like absolutely open. I do not want to be hidden. Why I should be hidden about anything? It's my right to self-determine my gender, and I would like to express myself. And your law is not allowing me to express myself and pushing me into male and female category. So that was a big baffle for me, and totally a different understanding I had it up. So that's what I said, it quite a lot of work to do. And things are slowly progressing. 2008 was the first time where gender law got established in UK, and after that there is not much of work happened. So gay community, gay and lesbian community is quite progressive here. Their rights are very well established, but transgender and non-binary people is something which is quite lagging behind. So don't think that you are in a society which is advanced. It's beautiful to meet people, they are so comfortable, but when it comes to paperwork, bureaucracy, it is something which is like quite back. Uh, so that needs to be taken care of very slowly and smoothly. So that is one thing I can say that specifically has been happening. Medically, as I'm working as again in the ICU, COVID ICU, all patients are COVID patients. So we'll be wearing PPE. So your gender is also covered. What has been not covered is your voice. So when you talk with people, is my voice, you can associate it with male gender. I do not have a deep voice, and I do not want that to go into and train my vocal cord into that and strain on it. So people do not understand that Sameera is associated with a female gender, and they started calling me as he and all. It's a very Bart's Health is a very diverse population of people, and it's beautiful place to work where you have got people from all sects and all different communities, BAME community, and so it's like it didn't take much time for people to understand that respecting the diversity and including people around. So I just have to sit and tell them that I'm so and so and I would like to. So the whole BAME community now understands and gives me my own space where I can put myself. So just imagine it just happened within 1 month, where back home I struggled for 10 years. So that's something which is really a good and paradoxical thing I can say about it.
You're a powerhouse, changing things wherever you go. The video is ready. Do you want to pull that up now, Sameera?
Yeah, so no, not the video, my PowerPoint presentation.
PowerPoint
Video,
presentation.
people would have seen it now by this time.
Yeah,
Yes,
so
Manisha,
that's
can
ready.
we go ahead? Please share it.
Sure, doctor. Is the screen visible?
Yes, it's
Yes.
good.
Okay.
Yeah. Okay, so next slide, please. Oh, I forgot to talk about Sati. Whatever my background, the logo, what you can see it up is the background whole work and my advocacy and my it's like establishing whatever work I have done it and learning the basic principle is out of the project Vistara, which we started up from Sati. Sati is an NGO, Solidarity and Action Against HIV Infection in India. And under Project Vistara, I could do most of the works for transgender community, considering the healthcare domain related to that. So the major work was done in Kerala, Gujarat, Tamil Nadu, and east side, Bengal and Manipur. So the project is still going on, and I hope we could do more and more work related and included through Project Vistara. Next slide. So what are the objectives that I have given a brief idea about how a transgender people live and what could be their palliative care needs. So let's go to the next slide. You all guys have seen the Nouri's life and the palliative care dimensions. And let us now reflect upon. Okay, so next slide. So I want people to, I hope this is visible well and listening. You have gone through the Nouri's life, and the diagram, the Venn diagram is in front of you. I would like to take one by one the examples of understanding her life and putting into it. So let's go to the physical domain, where we say that a stormy gender transition period. So what way Nouri's life was with respect to gender transition period, where Nouri said that she was Noor and she is a Muslim man, okay, and what way she has gone through it. So can anybody just reflect upon it? Maybe one or two comment. Yes, the way her father hits. So as I said it up, that family is where you reach out for the support. And here the family, her family is violent against her. So the community is not fortunate that the biological community is always supportive, rather than the first-hand violence happens for the trans community is through the biological family. And that's why many of the people, they run away from home and establish their own family structure for them. And that's how the, as my slide described about the cult, the Hijra cult, where they have their own beautiful structure. What about me? Like, what about Anjali, Amir? What about Vihan Pitambar? Vihan is now openly married trans man, and he is living with his partner, working in an IT profession in one of the MNC in Bangalore and living proudly with his partner, and they are open about their sexuality and gender identity, both of them. So they have established their own family norms now. Whether their biological family are there with there or not, it's like something which is totally a different aspect. Sexual abuse. Yeah, so physical and sexual abuse, it's something which is very common, and that's the reason why she got drawn into uh, somewhere as a fallback mechanism to live life as a sex worker. And mind you, sex work is work for them, and that is what they are living with their own earning, unless and until society gives them the way to pave up and live a dignified life what they want to. Till that time, that's their own dignity in their job. That is sex work or sex job. Violence, as I said it up, her father herself was violent. What about communicable diseases? What you guys heard or listened about it? What's your comment on that? Yes, she is. Avtar says that she is living with HIV, and probably she is one of the fascinating example in India in those early periods. She is now 65 years of age. She got diagnosed HIV infection 30 years, okay, earlier, and she was one of the few initial people back home in India where the HIV epidemic rolled on with the help of NACO, and she could fortunate enough to have the heart therapy, and she is the biggest example that people from this community can extend and can live their life at so much amount of stretch. And HIV is an infection where, as I said it up, ye HIV wale log aa gaye. Haan, it's okay. We are living with HIV, but we are living with a dignified life, and we prove that yes, we can live life with HIV in a very proper way. Okay, so are we going to understand this dimension of physical need of physical health and the disease which is going to affect them physically as well? Other non-communicable diseases, there's nothing that Nouri has mentioned about it, but when people are on hormone therapy, their risk for other non-communicable diseases like hypertension, malignancies goes quite high. The data is still in uh, infantile stage. Slowly, definitely, the next decade will be a place where better amount of data will be presented that how the community is been suffering with non-communicable diseases. Post-surgical related complications like renal failure, obstructive uropathies, these are something which are very, very undermined and not noticeable complications in trans women community. Trans women who get operated or do their gender procedures from not by non-medical way. All right. So this is what something which is very, very common. Nouri did not mention about any substance abuse, but considering the social stress, they get very much drawn into it towards substance abuse, and that is something which is a very huge problem for this community. Next slide, Manisha. Social aspect. Yes. What did she say about her begging and prostitution? She said that she worked, right? And what is she now? Yes, some of you had already mentioned about it, that she has her own family now. Okay, she has thrown away the traditional family norm, and she's living with her 60 children who call her as Amma and takes care of it. What about inequalities? What was there in Nouri's um, video about inequalities? Yes, mother of so many children now, she is. And she's so proud of it. She's in Chennai now. She stays in Chennai. This whole project is in Chennai running. What about inequalities? Any example you people can? Inequality and stigma. Yes, stigma is in terms of getting associated with healthcare. When you go and come in contact with any healthcare system, you may not be getting your rights established. Nouri may not get her health being taken care when she is going to go to any of the hospitals properly. Appropriate attention will not be there. Appropriate care and addressal of mechanisms of her health problems will not be there. So these are all very striking issues which the community is facing at this moment. Next slide. Psychological. Although this was not much touched in Nouri's life, but my previous presentation, I have talked about it. Yeah, even her children will face all of this. Yeah, to certain extent. But what is most important is at least her children have a shelter to come back. And the last few seconds of her video said that very clearly, if they do not have anywhere to go, it's at least their Amma is there for them, and they can come back and rest at that place. At least she is there to take care of it. What she has gone through it in her life, her children may not, uh, may not have to go through all those things. So she's there to take care of the mental stress, what has been happening with them. So to give you few more gatekeeping examples, um, as I said it up that uh, through one of my friends, Vinay's, the reflective practices where few of the community members, they expressed themselves how and what we medical health professionals, they do gatekeeping. And one of the example is uh, like for example, when you go to a doctor and ask them that, okay, I need to start up my hormone therapy, and many of the time doctors say that no, if unless and until you come in and sit in front of me in sari, that may not be I may not be giving you the hormones. So I need a period of 6 months to make sure myself, uh, being sure about it. These are real examples, people have said it up, and people have expressed concerns about it. So not fitting into uh, or establishing their own ethical norms is basically what they are practicing is gatekeeping. So this is what very importantly we need to look into it. As addictions and substance abuse, I have again and again been telling about that. Yeah, Manisha, next slide. Spiritual aspects. Nouri is now, it's like a benchmark. She has established herself. Her new family and children is going to surely take care of her last rites. If she dies, she'll be amongst her loved ones, those 30, 40 children who are there in her home. They are going to take care of herself. But imagine a situation where she could not have had that aspect, what will be her last rites and what would have been taken care of. Now, to give you a certain example, or I'll tell you about a story how death rites happen in Hijra culture. How many of us really know when a Hijra dies, what happened to Hijra's body, how the last rites are created? You know all the last rites, what happened when your neighbor dies? You will go and attend the funeral of your neighbor, but what happens to last rite of a Hijra person? So hijras, they are not typically socially not. Have you seen any time that a hijra person is being carried on the street, where the last rite is being done from their home to the smashan bhumi? You would have, I vouch on that, you would have never seen that. Why? Because socially they are not allowed to display their last rites, because it is something which is considered as bad shagun, going to bring ill health to the society and community when they are being openly taken or carried to the last rite. Yeah, you've heard that their body is beaten, yes, and they are supposed to take care of this at midnight, where the body is being taken care. There's Pashan Bhumis, and typically in North India, they have got more Islamic influence. So the body is being buried, and they have got their own burial process. While in South India, the influence is more of on Hindu culture, so they are being cremated. So these last rites do not happen on those fit, smashan bhumis, and happen somewhere else, which you people definitely will not be aware of it. They have their own smashan bhumis or places far, far away from the cities and villages where these people are being taken up. Okay, so this is what their last rites are being done, and where will be the grieving happening, how the grieving mechanisms will be happening, and what way the grieving supports will be there. So this is what needs to be understood about, and that's how the influence of uh, the culture or the religion plays on this community. Dr. Sameera, is they used to be buried straight? Yeah, as I said it up, that burial is when they have got the North Indian sect, they have got more of Islamic influence. They most of the time they undergo that ritual very well. Moshmi, it's really nice if you have seen it up. I appreciate that. Next slide. So going back to my last previous presentation and considering all these things, when we consider Nouri's life, you fitting into this as a healthcare professional or palliative care professionals, how we are going to take care of it. Stop doing conversion therapies. Accept them what they are. Understand how violent the healthcare is, and when you guys are witnessing that this violence is happening, actively intervene into it. Look into it where the curricula are inclusive. We are fortunate enough that Pallium India is including this sect also. Each and every aspect of curriculum and teaching where they are being taught, make sure that you include LGBTIQ needs also into the curriculum. More and more visibility needs to be brought. As Smriti said it truly, that initially this is an invisible community. Their invisible needs to be become visible. Okay, there are many people slowly coming and becoming visible, and the visibility has to be shown, displayed, discussed, and enacted upon. Next slide. This is repetition from my previous presentation where Vinay has given these narratives. Next slide. Yeah, next slide. Next slide. Yeah. So as I said it up that this is a global phenomena. Back home when I made this presentation, I was in India, and now I had a lovely time in Nepal in 2019, where I met transgender activists from all over Southeast East, MENA region, MENA meaning Middle East region, and one of my friend Wissam, who from Lebanon, and that was quite surprising that Lebanon has got a very good healthcare system, but unfortunately, it's still not conducive and open and well for doctors. Where he expressed himself in the first meeting itself that they do not know how to talk. I mean, you have a advanced healthcare system, but they do not still know how to communicate with trans people, and that's something which is a paradox. So it is something which is like it's happening everywhere. It's global. It is not just looking in and around in Pondicherry, Tamil Nadu, or in India. Next slide. Yeah, as I said it up, what ethics we need to follow it up. Respect to that gender is basically a self-determination. This concept is extremely important, and you do the practice of this, asking them again and again that how would you like me to address you as, rather than saying sir or ma'am. It is your responsibility that you learn it appropriately and enhance your knowledge and become competent by gaining knowledge through the teachings what are happening through these platforms, or learning more and more from the books or online experiences, rather than sitting and asking a client and learning from them on one-on-one basis in a very odd way. And unfortunately, when you lack knowledge, you probably land up into asking very unethical questions to the client, and that is something which is really embarrassing. I'm telling you, this is happening. This is happening in and around. Day in and day out, it is happening. Honest communications, if you have limitations, tell them that I am understanding and this is what my background knowledge is. That's how uh, you know the integrity in your relationship, client and you, will be maintained very well. And have a responsible behavior that you are taking care of and reflecting back to the society as well, where you will make sure that the stigma relating to this community is annulled, and will be advocating their rights as well, putting forward at a best possible position as well. Next slide, Manisha. This is a repetition again. Next slide. Yeah, and this is what is Nouri's life is going to be all about, and taking care of these best palliative care principles. There are many, I'm sure, and more research will be happening. I'm sure when the pandemic ends and the lockdown ends here, I'm going to wheel on my advocacies here with Marie Curie Foundation and few of the hospices where they are exclusively working here. I'm fortunate that I'm in London, and this hospice is very clear to me, very close to me, so that I can volunteer them for weekends. So more and more learnings are going to come for me as well to put forward in front of you all. So let's see how it goes. I'm sure by next 2 years, I'll be a much better person to bring out scientific evidence in palliative care medicine or palliative care as well. Thank you. I guess this is the last slide. Yeah, this I never forget to tell. And this Karthik, my spouse, we are together past 10 years now. He identifies himself as a cisgender man. We met 10 years ago. And I keep on telling him, my religious background is Islam. I follow Islam. And unfortunately, I won't say or use the word progressive. Progressive is a very narrative definition. My understanding about Islam was also that it is not that progressive religion, but it is not that way until I met few of the community members in Nepal who are Muslim and transgender, who follow Islam and are transgender, and made me understood that religion is something which is very well and misunderstood. Islam as a religion, where I myself misunderstood, and there are many ways to explore and tell it to the radical Islamists who narrow themselves their concept, where I always had a fear that my last rites, as my janaza meaning dead body, needs to be wrapped and taken care of in a very well way, where my last rites has to happen in a very appropriate way, what the Islamic cultures and rituals are. And as I said it up, that many trans people are not blessed with that. So I always keep on telling Karthik that let me die before you. And if I die, you're the one who's going to take care of my last rites, and understand that this is what the last rites and that spiritual or religious bracket happens. And please do my last rites in the same way. And we have a huge age gap between us, and I'm sure that I will be older and dying, definitely dying earlier than Karthik. That's it. Thank you very much.
May you live a very long life, Sameera.
Gosh.
Thank you so much. We have just over 15 minutes for discussion, and
Lovely.
I'm sure that a lot of people have a lot to say. So Alpa, you had said that you wanted to share something. Let's keep our sharings to about 2 to 3 minutes so that we can hear from more people. Alpa, please.
And thank you,
Can't
Smriti.
yeah, now we can hear you. Yes.
You can hear me? You can hear me now?
Yes, clearly. Thank you.
Okay. Yeah. Dr. Sameera, I am a volunteer. I've been volunteering all my life from 2004 till today with various NGOs, and I'm very passionate about cancer and its causes. My mother also had been doing that for a decade. So that is how I am into this. And currently I'm in Mumbai, but prior to this, I was in Bangalore, and I had the privilege of volunteering at Kidwai Memorial Institute of Oncology for almost 12 years. And also, I was part of the Indian Cancer Society, where I volunteered for 5 years. So Indian Cancer Society, I used to go to different hospitals in Bangalore, and that's how I got so many experience in counseling. And I would like to share two of my experiences. One is that at a government hospital, it is ESI hospital, I was there volunteering, and they had given me weekly twice, and I was there as a regular counselor visiting. So I remember this day very well. When I went there, a transgender, she entered, and believe me, in a government hospital, and between 2 and 4 in the afternoon, they give 40 tokens in the morning, and the doctor's cabin is just next to that. Both of our cabins are next to each other, the doctor and then the counselor's cabin. And I remember the moment she entered, all the 40 people standing in the queue with the patients, everybody left the place. It was so sad. It was so very sad. And the doctor also got scared. I said, see, somebody has come to, I don't want to mention or talk bad about anything of the person, or see, that's a personal thing. But I felt so bad. I said, see, we can talk. We are here to serve the society, not to scare somebody off or not to give them. And then I spoke to this lady. She spent almost 1 hour with me because she came to know that I was the only one at that point of time to talk to her. She just shared everything, like very similar to what Noora went through or the community goes through at large. And she said, I've never seen any human being talking to me like this. It's been ages that somebody has given me so much respect. I just didn't do anything. I was sitting there and just listening. I gave her that space and she could share everything. And post which she was comfortable, even people around the hospital were comfortable. But that window I gave her, and she could like unburden herself, all the emotional baggage over the years, whatever it was, she could do that. The other thing is, I also have my as a private practice, I've named it as Pehchan, a mission to help identify yourself. So that is my private practice, but even that is pro bono. I do not charge anything for that. So I had just started in 2013. I had taken a small place in Bangalore and I had started. And the first client, I would say, was again from this community. So I had one other counselor. She immediately left the room. She said, Alpa, you handle, I cannot sit here. See, I'm not talking that I did something good or bad or whatever about myself, but I had given the space, and that client was referred by a doctor, my family physician, who had referred to this particular transgender, that you go and talk to her and she will help you unburden. So this is what I wanted to share. But even that person also, they go through so much. And in the journey, I have come across many, and I try my level best to help them, at least empathize them with what they are going through. And an amazing job you're doing, Dr. Sameera. I'm so happy and proud of you. And thank you so much for the knowledge you shared today. Thank you so much.
Thank you, Alpa. Thank you. And so heartening to hear that you were there at times when other people walked out. It makes me sad that a counselor would walk out, because one of the basic trainings of a counselor is to show non-judgment and unconditional respect.
Yes.
And sometimes I wonder, there are boundaries to that, and so it's really not completely unconditional respect that everyone gives. But you were there, and that's just hats off to you also. I think a lot of the fear that we respond from a space of fear, for people to just stand up and walk out, because a lot of it has to do with lack of information. I don't think anyone has ever taken the time to educate themselves. And fear is usually a byproduct of misinformation or lack of information. And I hope that everybody on this call today will take these learnings outside and share with others in in not just Noori's video, but just so many things that we learned today in terms of the definitions, the terminologies, the challenges, the suicide statistics, which really we should be hanging our heads in shame that we're allowing a whole community to go through something like this. So thank you, Alpa. Linda, did you want to say something?
To Miss Sameera, thank you for your personal sharing. What would be the single factor that allowed you to be the person to have the courage and to reach where you are? Because as a counselor, to sensitize students, we need to move in that direction so we have an inclusive society.
Not having any options and creating that options, that only led me to go ahead and ahead and ahead. That's it. And second and most important thing, and I keep on saying that, probably I'm fortunate that I kept on seeking those helpful souls on this earth that they bring beauty to your life as well. So it's like motivation, if it starts from within, people will come and join you. It's like, it's it will sound like too filmy kind of thing, but aap chalte gaye aur karwa badhta gaya. So I'm sure that whosoever are there, and I'm living with this now. It's just second month now, and I have got so many beautiful friends here who understands me, and it's something which is keeps on giving you a boost that yes, I have got this support now. I can climb up my next step. I can climb up my next step. I can climb up my next step. And I guess it is never ending.
Thank you, ma'am.
Yeah, Shruti, I'd like to share two of my experience. For the first, it's only my audio, Sameera, and rest. For the second, I'll switch on my video. So this happened while I was doing my dentistry. I'm from Chennai, Tamil Nadu. I did my dentistry from Savita. So it takes about, it's a 25 kilometer thing. So half of my drive is by the college bus and the rest is by the public transport. I generally avoid the public transport because men brush. And I always wait for a lady special so that I hop into a lady special. And on one such day, I hopped into a lady special and the conductor asked me to get down. Just because my hair was short. I was in a salwar. But just because my hair was short, so they don't see the person. It's each one's perception. At that point, I was a teenager, I was hurt, but I knew what I was. So I cared less to what the conductor thought about me. But I got off the bus because he said he wouldn't take off the bus otherwise. So I got off the bus. And now I'll click on the video. Yeah. This is a book which was done by my mother's student in Chennai. And I was always interested because I never knew about them and I had a curiosity. It could be because I was asked to get down off the bus. So I was still holding. I think we lost Shreya.
Shreya, yeah, we've lost Shreya I'm sure she'll log back on. In the meanwhile, can I invite anybody else who has any, specifically speaking to Sameera's presentations, is there something new that you learned today that is possibly something that you had never come across before? Is there something that you'd like to share with people beyond this group? Something that touched your heart in the presentations that you saw? Or how do you think you'll be able to incorporate this into your practice? I'm just going to, those are just some sort of prompts if anybody would like to share. Everything was new today. Thank you, Sunita.
Hi, Dr. Sameera, this is Vandana. First, I want to thank you for this beautiful presentation. I have always felt the community to be a part of the normal mainstream, but maybe there were some aspects which I did not understand. Today, I feel better connected to the LGBTQ community. Thank you so much for sensitizing me to so much that I did not know. And I will, my endeavor, though earlier also, I never felt it was different, but now I'm going to put in that double effort to include them in my life and make my effort to make them a part of the community. Thank you so much for being here. And thank you, PALLIUM India, for getting Dr. Sameera here. My heart is bursting with joy. Thank you so much. So much love to you.
Welcome back, Shreya. We can.
Yeah, so my second rudest shock happened on that day. My mother was explaining to my son Vikas as to how a transgender will look and how they'll be. And she just pointed to me, this is how they would be. I would only say my son was 21 and not younger for him to have a shock or anything. And he also knew his amama, his mom's mom, as to how she'll throw her analogies. So he didn't take it to heart. But I had palpitations on that day. It did hurt me. But since it was my mother, I just kept quiet about it. I came home and then I asked my son what he felt about the example that she gave. Whereas she's a person who has even spoken for them. And I didn't know why a comparison should be made. Everybody sees the other individual only from their perspective, only from their personal experience. What if I don't even want to have a gender, like how Sameera said? So I decided much, much earlier, about 8 years back. So I changed my wardrobe. I took public transport and I wore men's clothes, which means I'll always be on a women's type of attire, but it'll be parallels and a shirt, all custom made. I design my own dressing. And I would wear my bag in front. I'll have a backpack, but the backpack will not be in back, it'll be in front, so that no man brushes against me. So just to help myself to come over my fears, these were the therapies that I gave. And I would welcome a transgender to sit next to me. I wouldn't mind a man who's standing, because in Chennai, we have sections in the buses where females have to sit separately and the men have to sit separately. But if I see a man who's standing and there's no place, I don't mind offering my seat, which is vacant, next to me. It's up to him whether he wants to sit or not. So for me, it doesn't really matter who I am. I know who I am. Why should the society know what I am? So I just brought about my strength only in that way and nothing else. And I'm pretty much happy the way I am. Still protecting myself in a men's attire, but with a woman's heart. And I have this duality and I'm very, very happy about it.
Very well, you are expressing yourself.
Thank you, Sameera.
Thank you.
Yeah, that's yeah. Thank you very much. And this just goes to show that the violence, the gender violence, is on a spectrum. It's directed at pretty much everybody who is not currently dominating the apex of patriarchy. With no offense to all our gentlemen on this call. But the problem here also is which we need to think about is how casually within our own families these kind of labels, or to use a particular label in a derogatory way. I mean, what if somebody says, okay, transgender? It's the way they say it, right? It's not transgender in and of itself. Carries no negative connotation. But I think a place to start for all of us is within our own circle. There are so many terrible jokes that get sent around on WhatsApp. There's so many. We cannot affect the systemic change, making healthcare more accessible to different communities.
Smriti ma'am, your voice is becoming very low. The headset.
Yeah. Can you hear me now? Better?
Yeah.
Yeah. So what I was saying is that if we don't call out bigotry and the kind of discrimination that we see on a day-to-day basis within our own circles and families and friends, we have no chance of changing it on a systemic level where we want to make healthcare more accessible. We want end-of-life care for LGBTQIA communities. Those are very big things that we're asking for. If we're not able to call out, I'm not saying go up against all the people in your family and say, hey, what you're saying is wrong, but don't participate in a conversation like that, because we are all responsible. So that's just something that I wanted to highlight, because we let it pass casually when when it's from jokes and things like that from people that we know, and that's where the system needs to change first. Before we close, there's one important point that I wanted to highlight, Sameera, which I want to invite you to speak on. Is you brought up last rites, you brought up end of life. We are at a point in our country where we're still fighting for appropriate care for the vast majority, right? You're a critical care doctor also. You see so much futile treatment happening in ICUs. And I think my guess is that it is doubly hard for people from the LGBTIQ community, because of because of the community they come from. Now, we at the end of our lives can still hope for our loved ones to be besides us. But if a system doesn't recognize gay relationships, or uh, uh, non-traditional relationships, then that is a huge spiritual and emotional burden at the end of life also. So I just want you to say something about that before we close the session.
Yeah. So as we say that we do not have the concept of understanding about non-biological family. And as a healthcare professional, somebody who's admitted in the ICU or in under you, first thing you say that I would like to talk with the family. And for people belonging to LGBTIQ community, sometimes it becomes difficult for them to convince it that I am his or her partner.
Yeah.
And I'll tell you it's like it is something. The irony is that even though you say that you need to use a very specific word, that when you say family, it has to be husband or wife or brother, mother, sister, okay, and then only I'll be communicating with that no, he or she is reaching end of life and we will not be doing anything and will be allowed into it. We define in terms of married relationship, where marriage is not me and Karthik are not married, we are together. We need not have to have that strict, rigid relationship boundaries where we say that we are progressive, that marriage is being taken off and now civil relationships are acceptable. But how many of medical health professionals, when we say that civil relationships are being accepted for heterosexual couples, where one partner is admitted under them and dying, and you are communicating and understanding that that person is saying I'm partner to him or her, heterosexual couple. And the same thing, is it going to be applied to homosexual or trans couple? That is second thing which needs to be understood about it. And what are those intricate definitions or words being used it up at such a critical moment, that dissolving that and not uh, focusing too much on it. When somebody says that I am the carer, and that is something which is best possible way to describe, rather than saying I'm a husband, I'm a spouse, I'm a partner, I'm the only responsible carer. If somebody says that, just respect that and go ahead explaining and giving the right for that. A very prominent example very recently happened with one of my journalist friend in Delhi, in one of the biggest corporate hospital, where her partner got admitted in the ICU, and she asked for a health update, and the doctor said, "Who are you?" So she just said it up, "I am her partner." What is mean by partner? Why I should inform you this? So rather than lingering on or sitting on these words, just taking it into it, and if somebody is not comfortable in describing it, that how and what way, proving that relationship, when what I need it all the way is something which is very time sensitive and time bound moment, where I want to get to know my loved one's condition at that particular critical situation. So a healthcare professional need to understand that. This is what all I want to say it up very specifically. And when very sensitively we say about end of life care, that is something which is a time bound situation where this all communication aspect has to be intensely narrowed. And that's what last eco session, Smriti, when we talked about it, where one of our member put forward that yes, AIMS has got now included this also in the policy. And that was my first reaction. When you say it up, why not you explicitly write it down there that a partner, a civil relationship, and LGBT community as well. Show it up the visibility also on your paper that the community and the family structure of an LGBT community also will get displayed into it. And that is what all is needed about it. Rather than just swiftly writing down or broadly writing it down that civil relationship or partners, write it down what is defining moment for the partner or being in the relationship for LGBT community as well.
Absolutely. Yeah. Thank you, Sameera. And my final comment for today is that one of the things that we advocate for in palliative care, especially in Pallium India, is access to essential medicines, access to essential and affordable medicines, especially for pain relief. So I think most people here know that we are deeply involved in that. And Sameera, with your permission, I'm going to also share that Sameera and I once had a conversation about the supply chain being disrupted during the pandemic and how we were worried about morphine not reaching people in need because the trucks were not going, the state boundaries were closed, all of that. And in that conversation is when Sameera highlighted to me that for the trans community, hormones, estrogen is an essential medicine. How many of us have thought of that? So what is essential should be defined by the population and not just by the policymakers. If estrogen is an essential medicine, and if Sameera had to carry hormones to the UK, it's something for us to think about. Because when we have a headache, those are things that are transitory. This is something that is life defining. So just to leave you with those last thoughts, what is essential to one person or one community is different for another person, another community, and one of the cornerstones of palliative care is compassion. So thank you all very much for attending today's session. Don't forget to fill in the feedback form. And if you have any comments, if you have any questions for Sameera, please send it to us and we will be sure to forward it to her. Sameera, thank you very much.